Hello and welcome. My name is Liz Patterson. I'm the Director of Allied Health Education at Edmonds College. And today what we'd like to share with you are some programs and pathways within the allied health professions that you might like to consider. And I think, as some of you have found out in some of the other sessions, that allied health encompasses a wide range of health professionals. We've got medical technologists, cardiology technicians, imaging technologists, dental assistants, pharmacy technicians, occupational and physical therapy assistants, respiratory therapists. It's basically all of those professions that aren't nursing or medicine. So there's a lot of us hanging around. I brought some of my colleagues from professional areas in medical lab sciences, patient care services, pharmacy practice, and behavioral health services. And they're going to talk a little bit about their own backgrounds and the professional areas. For myself, medical imaging is my area of practice. And I heard someone saying they were interested in ultrasound, which is an area that I spent a lot of years in. But radiology, ultrasound, and MRI imaging. I've worked as a staff technologist and administrator in large inner city hospitals, small neighborhood clinics in some of the ethnic areas of Toronto, and specialized facilities as BC Children's Hospital for a number of years. I've also worked on the industry side of things for both a medical device and a biotechnology company. And I've done clinical education, product development and research, and international marketing. Now in the education field, I think that I'm a great example of the many pathways that are open to anyone who comes into healthcare. And I encourage you to be open to any opportunities that might come your way as you take your journey through healthcare. Next, I'd like to introduce Erika.
Hi, my name is Erika, and I've worked in several areas of laboratory sciences. I currently teach full-time for the CLA program at Edmonds College. I've worked in healthcare now for 25 plus years. My background demonstrates all of the different branches of laboratory science that a phlebotomist or that a CLA certificate can lead you. I've worked as a phlebotomist, as a clinical lab assistant, in government research, social services, IT, more recently as a subject matter expert for phlebotomy-related lawsuits, and where I am right now in education. So as an educator, I really try to incorporate all of these experiences into my curriculum in order to provide my students with a well-rounded educational experience.
Thanks, Erika. And next on our list of professions is nursing, and I'd like to introduce Terri.
Hi, I'm Terri Glazewski, and I'd like to welcome all of you and thank you for joining us today. As Liz said, that I am a registered nurse with a master's degree in nursing. I've spent the past 35 years caring for adult patients in both the hospital and in outpatient facilities. My main emphasis was cardiac or heart patients. I chose to care for cardiac patients because I was always fascinated with the interaction between the electrical and mechanical systems of the heart and the various interventions that can be done to treat many different heart problems. Along with the direct patient care that I have done, I worked as a case manager, a legal nurse consultant, and a hospital administrator. Now I'm full-time at the college and the director of the CNA program. I currently teach CNA, acute care CNA, EKG, monitor tech, and ER tech courses. I really enjoy teaching and assisting students to find their direction in healthcare.
Thanks, Terri. And next on our list is Brent.
Hello, my name is Brent. I'm a pharmacist and a full-time instructor in the pharmacy technician program at Edmonds College. I chose to pursue pharmacy because it makes use of math and science, two interests of mine, in the context of making a difference in patients' healthcare. There's also an educational component to working as a pharmacist, which I think lends itself well to work in the classroom.
Thanks, Brent. And Katriana, I see your questions about tips for people wanting to be an ultrasound tech. You have to have good vision, number one, because it's all imaging. And class is recommended for an ultrasound tech, but quite honestly, the majority of the allied health professions, anatomy and physiology are big ones, communication skills, math, basic math, specifically for imaging, physics, because imaging is all physics-based. So as you can see, we all come from different areas of practice, but what we do is we bring our individual expertise and experience to work together to provide the best start for you in your healthcare careers. And if you're thinking that the education for the healthcare profession might be a bit intimidating, what I'd like to suggest is look at taking it one short step at a time and follow a pathway. And what I've shown you is the pathway that we have here at Edmonds. Other colleges have similar pathways for their programs. But you can start with a very short 3 to 6 month certificate as a phlebotomy technician, nursing assistant certified, electrocardiography, or shortened to EKG monitor tech. And that actually gets you a work-ready credential where you can actually start to work, get some experience, and explore different areas and maybe find your pathway that way. These can take you into a larger certificate. Typically, they take a year, up to perhaps a clinical lab assistant. You can move along the pathway, or you might decide, no, I'm not so sure that all this patient care stuff is for me. And maybe I want to look more at the pharmacy area. Maybe I'm more interested in what's going on there. Patient care, emergency room technician, which is what we call stackable certificates, which is where you build on skills. And also one of our newer programs, the mental health technician, which actually can take you into patient care or mental health. Gives you some pathways. All of these can go up to an associate degree, which is your typical 2 years, which can transfer and lead to a number of 4-year degrees at community colleges or universities. And these degrees can take you further in your area of practice, like medical lab sciences or pharmacy practice. It can move you into a more administrative and leadership role. It can also open up opportunities in community and public health. It might even take you to the business or research side, which is where I went. And I think the key really is to start and figure out where you want to go. How far you go is entirely up to you. So to talk a little bit more about the medical lab sciences area, Erika, I'll throw it over to you.
Thank you, Liz. So right now, you guys are in a really good place because there is a huge demand for new graduates in clinical lab sciences field. Careers in laboratory science are a good fit for you if you are somewhat analytical, enjoy problem solving, and are interested in the science of healthcare. CLAs can work in many different areas of the lab, such as the main lab, specimen processing, in a support role in blood banking, in a combined role with the phlebotomist, in a clinic or a large hospital, in a research facilities, and in some industrial labs. Some CLAs, like myself, even find themselves in IT, building or teaching people how to use the software used in the lab. This is a field in which you can really choose the environment that you want to work in and pair it with your personal interests. Students that complete a CLA certificate can also easily move up into higher level positions such as a CLA lead, lab manager, medical lab technician, histology tech, and medical lab scientist with just a little more experience and or just a little more education. Many students use the certificate as a stepping stone to get into physician assistant programs or medical school. Information from laboratory analysis assists physicians in both diagnosis of diseases such as diabetes and cancer and in monitoring effectiveness of treatments. This group has been very busy over the last few years using their expertise to monitor and track the spread of COVID-19 as other members of their profession participated in the development of vaccines that help slow the spread of COVID. They also assisted in the development of antiviral drugs used to help deal with the symptoms and shorten the time of illness for COVID-19 and other viruses such as the flu.
They've been a busy group. Thanks, Erika. Terri, would you like to tell a little bit more about some of the entry levels that might take people into a nursing pathway?
So I would like to talk about the patient care technician role, and it's known as a PCT. And what PCTs do is they represent an essential part of the patient care team. They assist the medical staff as well as the nursing staff in providing physical care for patients, and they are able to develop relationships with those they care for. Students who choose a cardiac pathway can either perform EKG testing, or they can watch computer screens, viewing live monitor rhythms, and intervene as necessary. They are called monitor techs. Other students may choose the emergency room pathway. With this pathway, PCTs work alongside doctors and nurses in the care of patients with a variety of illnesses or injuries. The PCT profession gives caregivers many options within the healthcare professions. They truly make a difference in the lives of patients and their families. There are currently a lot of opportunities for PCTs in the Puget Sound area due to our ever-aging population, and many more expected in the next several years. The PCT certificate is a great gateway to many other professions, such as working in the cardiac catheterization lab, sonography, nursing, performing stress testing, and can be a stepping stone to management positions within healthcare. Like Erika's program, I've had students have gone on to become physician assistants.
Thanks, Terri. So you can see something like this is a great way to explore different areas of the health professions to go in. One area might be pharmacy practice, and at Brent's, what's going on in pharmacy these days?
Thank you, Liz. Well, first, pharmacists commonly review and fill prescriptions. We advise prescribers on therapy choices and dosing. We consult with patients on details and the appropriate use of their medications. Pharmacists are also increasingly involved in direct patient care functions, such as review of diabetes management, administering vaccinations, and MTM, or medication therapy management, in which a patient's entire drug regimen is reviewed for optimizations. I feel very fortunate because I get to work with students every day who are studying to become pharmacy technicians. In our classes, we look at ways medications work in the body, how those are applied in pharmaceutical care. My students learn to use evidence-based tools for researching drug information and work in teams to present what they've learned to their classmates. We practice calculations that are important in medication dosing and preparation, so that students are well equipped to work in hospital, retail, or other pharmacy settings. We learn techniques for sterile compounding, laws governing pharmacy practice, and terminology used in pharmacies and throughout healthcare. Students completing the pharmacy technician certificate at Edmonds leave our program with hundreds of hours of classroom and skills lab training, as well as extensive hands-on experience in a pharmacy setting. These students are prepared to excel on their certification exam and apply for their pharmacy technician licenses. There's huge demand for pharmacy technicians, and graduates are able to quickly find employment in their chosen field.
Thanks. And our faculty person for the behavioral health sciences is actually teaching. So she gave me a bit of an overview to talk with you about, but behavioral health describes the connection between the health and well-being of the body and the mind, which kind of takes us to the concept of a holistic view of your clients, where we look at the whole person, as opposed to just looking at physical issues like arthritis or mental health issues like depression. And I use that example because something that seems as simple as arthritis can actually cause chronic pain. Chronic pain can cause depression, and depression can cause sleep disturbances. It can affect the appetite. It can cause pain and headaches. So they're not necessarily independent of each other, and we need to assess and treat for both in the same client. Familiar professional titles in this area probably include social worker, therapist, psychologist at the higher levels, but you can think about starting points that require a certificate, such as a mental health technician, or an associate degree, such as a substance use disorder professional, and getting your license to practice in Washington State. For those of you who might be interested in this field, but you're not quite sure, the mental health technician might be a good way to explore both the patient care side of things and the behavioral health side of things, as it includes courses for the nursing assistant certification alongside the courses that help mental health techs work with clients on activities related to their mental health issues. So it might help you find your pathway. As you can see, there's a lot of choices and they might seem a bit overwhelming. So I think one of the common themes that I've heard throughout this conference is think about your interests, think about your professional areas of practice and things that might fit. You know, Brent says he likes science and maths. I like technology, and ultrasound is very technology based type of profession. Terri enjoys working with people. Keep in mind that there are a lot of common courses. Again, classes recommended for an ultrasound tech are also recommended in the medical lab professions, are also recommended for the pharmacy professions. We all pretty much get that same basic foundation of biology, science, and math. The other nice thing is if you decide to switch, you don't have to start over again because we have that same foundation. The other thing I'd like to throw out there that I haven't discussed, and I thought of this morning as I was drinking coffee, and I was looking at the pathways again, and one of the things to think about is you can actually start your journey anywhere along this path you like. You can start with a short certificate, you can start with an associate degree. It's really up to you. But one of the things that I'd also like you to keep in the back of your mind is the word teach. Faculty are also needed across the healthcare professions, and many of you are going to gain teaching experience as students cross path in their clinical rotations. You'll be working with students, and that tends to be the starting point for faculty because they find it brings great satisfaction, gives them an opportunity to give back to their professions, and it's often what leads them to us at the college. That's what we have for you today. One of the things that I will also say is there is a PDF of this presentation on my speaker page on the Cadence platform. And if you notice at the bottom, I've given you contact information for the various faculty that have talked with you today. So feel free to go in and download that. Feel free to contact them with any questions that you might have. And it looks like we've got a little bit of time left. So if there's any additional questions, we'd be happy to answer them. It doesn't have to be about these professions. We can try and see if we can help you with others too.
Liz, Brenda is asking, what are the costs associated with these programs?
It's going to be different, but determined kind of based on the length of the program, but I'll use the pharmacy tech as an example, because it and the patient care tech are both between 40 and 44 credits, and they're going to cost you about $9,000, and that's for the whole program. And that would include, when we do costs, we not only look at tuition and fees, but we're also trying to look at textbooks, other supplies. You'll need things that, like scrubs for certain professions. You might need to get a stethoscope, that kind of thing. And so $9,000 is a pretty good ballpark figure for a 9-month program. So you figure about $3,000 a quarter. And Erika, I see, has put a link to our website. And actually, there are costs for each program on there. Unfortunately, we haven't updated them since the pandemic started because we've been kind of busy. But they can give you a good ballpark figure, particularly for the textbooks. Those haven't changed very much. Antonio, there are lots of different types of scholarships available. Our college foundation has scholarships, and sometimes in certain professions, different groups will send us information with regards to scholarships to help students out. And we always share that information with you. Also, financial aid. And there's also some opportunity grants for people who are changing careers. There's lots of different financial aid opportunities. And so you can think about contacting financial aid.
If I could just,
Katrina, I see that you want to know what programs to join for ultrasound. So I know Liz is the expert on ultrasound, but I would just like to say that I have recently had 3 students get into the Bellevue ultrasound program at Bellevue College. And it's very difficult to get in. And they tried several times. And then what they did was they came to Edmonds and became CNAs and kept increasing their education. And they were taking care of patients. And all of that kept improving their resume so that eventually they did get into ultrasound school like they wanted. The same thing happened with our students that actually got into the UW Medics Physician Assistant Program. They started and kept going to school.
Thanks, Terri. Brent, you had something you wanted to add.
I did. I just wanted to interject. There was a question about scholarships that are available, and I thought I'd mention that just earlier this week, I saw an opportunity come through that was forwarded by Phi Theta Kappa, which is a Walgreens scholarship offering several $100s for students who are taking one of the pharmacy tech certification exams. And so I distributed that information to all of my students. Whenever we see opportunities like this, we want to make sure that students receive that information so that you can take advantage of scholarship opportunities like that. But yeah, that's a great question. Thank you.
Yeah, we keep an eye out for those things, and we have good connections with companies like Walgreens that forward that information to us. And to Terri's point, doing a nursing assistant certificate is actually a good foundation for a lot of professions, because it really just teaches you just how to look after people. And even though as an ultrasound tech, I wasn't doing nursing per se, I still had to look after the person that I was working with at the time and make sure that they were comfortable. If they needed a bedpan, I had to give them a bedpan. And I remember one of the first things when I started in radiology, in our orientation, the first thing we did was spend 3 weeks up on the floor working alongside a nursing assistant, learning how to look after people. We also learned how to do vital signs and stuff. And so I think Terri's point is a good one, is you can always think about that as a starting point. From Erika's standpoint, for emergency medicine, paramedics, phlebotomy is a great place to start, because it gives you, again, that experience of working with people, calming them during a procedure that, nobody really likes needles. And it's also a useful skill because paramedics, PAs, they draw blood. So you can take those kinds of skills to that next step.
The other thing I would just like to add real quickly is we have relationships with employers, every one of us. And frequently I get employers that say, hey, Terri, we're looking for a CNA. We're looking for EKG tech. Do you have anybody? And I'll post that in my classroom. I also, in my virtual classroom, I also will send out the email to my prior students in case any of them are interested. So not only do we help teach you a profession while you're with us, we look out for you for years to come.
We need people to look after us when we get old.
Me sooner than some of you.
Hey, wait a minute. Good questions and good things to think about. And I thank you all for coming. Again, download the presentation. Where any of us are available by email, or you can leave us a voicemail on the phone, and we'd be happy to answer any additional questions that you have.
Thank you all for joining us today. It's so great to have you all here.
Have a great day, everybody. Thank you.